As coronavirus case numbers spiked in March and April, hospitals in the US scrambled to buy supplies like personal protective equipment and ventilators. That sudden, unexpected cost coincided with the suspension of non-essential treatments, many of which generate a lot of money for hospitals. Add in the unique structure of the US healthcare system, and hospitals can quickly feel financial pressure.
Most of the COVID-19 patients were elderly and low income. And so it was really the public insurance companies, Medicaid and Medicare, that were reimbursing for the COVID-related activities. And so they were losing sort of the lucrative commercial reimbursement and getting a little bit more sort of public sector reimbursement, but it certainly didn't make up the difference.
Hospitals in early coronavirus hotspots like New York are starting to perform so-called elective surgeries such as hip replacements by applying for waivers. But in other states, including Texas, where case numbers are shooting up, the lucrative procedures are being suspended again. Even in rural areas that haven't had many coronavirus cases, some people are staying clear of hospitals due to fears about contracting the disease. With more than 120 rural hospitals closing since 2010, that section of the US healthcare system was already in trouble before the pandemic.
We need to make sure that the public understands that rural hospitals are very safe, that they are ready to take care of patients, and keep them safe from contracting coronavirus while they're in the facility. This is very important, especially if you're experiencing symptoms like stroke or heart attack. Don't die of doubt.
The American Hospital Association estimates the industry is facing more than $300 billion in losses due to the coronavirus this year, and hospitals are already going bankrupt. Even if states can fully reopen again soon, hospitals won't be able to make back all of their lost revenue. Here in the US capital, patients are starting to come back for treatments that were put off during the city's lockdown. There will be some appointments, though, like semi-annual checkups, that were missed and will never take place. Giles Gibson, CGTN, Washington.